Hello, fam. Welcome to another episode of the Prescription for Better Living podcast. As always, I'm Dr. Hernando Carter, your board certified internal medicine physician. Yes, still your primary care extraordinaire. And this is the Prescription for Better Living podcast, where we discuss all things health and wellness in a hip and relatable way. Simply stated, our goal is for our community to live long, healthy, high quality lives. This is episode 22. Yes, we've been doing this for 22 weeks. And for those of you who've been with us all the way back to the beginning to now, thank you for your support. And if you are new to the PBL family, we say welcome. So you know what I need you to do. I need you to subscribe to the YouTube channel. I need you to like the video. I need you to comment on the video. I need you to share the video everywhere you go. Scream it to the top of your lungs. Hallelujah, Dr. Carter is here. Also, if you would like to continue to support the work that we do with this podcast, there are a couple of ways you can do that. You can become a part of our Patreon family. You can just go to patreon.com/Dr. Hernando Carter. Join there, $5 per month. What do you get for that? Well, you get behind the scenes access to the recording of each episode. You get more engagement with me. You get wellness meetings, group talks, etc. So it's worth your while. Also, do you have a business or a product or an event coming up? Would you like to be an episode sponsor? If you're interested in sponsoring episodes of the podcast, you can email us at contact@rxforbetterliving.org. That's contact@rx4betterliving.org. Thank you for your support. So this is episode 22. And you know, we've been going on this. We go on journeys, y'all. And so we've been going on the health disparity journey. And we really have been talking a lot about the medical industrial complex and our community's mistrust of the medical industrial complex. The reason we've been zeroing in on with laser focus on our community's mistrust of healthcare, all things healthcare, is because you have to get to the root of what is causing the disparity in order to fix the disparity. And we know that medical mistrust is a long ago established fact in our community. And so we've been getting into some of the reasons why we have medical mistrust. We've examined the history of the Tuskegee syphilis study. We also talked about the mothers of gynecology and everything that happened surrounding that. And with each of those episodes, we really got into the medical experimentation on and exploitation of people from the Black community. Remember that we said that while the mothers of gynecology, that whole thing happened back during slavery time, the experimentation of people in our community has persisted through slavery. So we talked about the Tuskegee syphilis study that ended in 1972. And there are people who are alive, well, and kicking today who were alive while that study was going on, before that study concluded, and right around the time that study concluded. I talked about members of my family who were living then, who are still living today. And so what you have is that you have the perpetuation of mistrust of the medical community. And I'm not pointing fingers or playing the blame game with our community. No, I'm saying yes, it is very well founded. The mistrust that people in our community have is very well founded. we're just taking a deep dive into looking into this. And what we're going to do is we're going to compare and contrast then and now so that we can, yes, acknowledge what happened to our people historically. And then we can start talking about how things have changed to date that maybe will give you a different perspective and maybe give you some reasons why you can begin to open yourself up to trusting a little bit more. All right. So, again, just to recap, in episode 20, we started talking about what was going on with well, let's go back to 19. 19, we talked about Tuskegee syphilis study. And in 20, we took a detour with DEI. 21, we talked about the mothers of gynecology. And these were enslaved women who were experimented on by J. Marion Sims, who was a surgeon in Montgomery, Alabama. And they were operated on without pain medication or the equivalent of what was anesthesia back then. We also talked about the work that's being done to bring attention to this with the Mothers of Gynecology Monument that's in Montgomery, Alabama. We gave you that website. Please check them out. So now we're going to talk about another example that is, I think, very well known because of cable television and because of Oprah Winfrey. There was a book that was published, I think about maybe 14, 15 years ago, The Immortal Life of Henrietta Lacks. Y'all heard of Henrietta Lacks, Lacks? Well, initially, again, it was a book, The Immortal Life of Henrietta Lacks, and Oprah Winfrey did a movie for HBO by the same name, The Immortal Life of Henrietta Lacks. So let's talk about Henrietta Lacks. Who was Henrietta Lacks? Henrietta Lacks was a mother, a young woman of five, a young mother of five, who began having some vaginal bleeding. She was having vaginal bleeding and decided to go to the hospital. She went to Johns Hopkins Hospital, which is a world-renowned hospital, still to this day. And she went to Johns Hopkins because Johns Hopkins was one of the only few hospitals that would take care of people of color, of African Americans, especially those who did not really have the ability to pay. So Henrietta Lacks, mother of five, went to Johns Hopkins with vaginal bleeding. She was evaluated. She had an exam, and eventually she was found to have cervical cancer. Treatment options were few back then, but she did get what was the commonly agreed upon state-of-the-art treatment back then, which is radiation. But she died. She died. So what is common whenever you have a mass or cancer or something that they suspect is malignant is you'll get a biopsy, right? And that's what happened to her. And as is the case, whenever you get a biopsy, her tissue samples were sent to a lab. And they were received by Dr. George Gray, Dr. George Gay, G-E-Y, who was a prominent cancer and virus researcher there at Johns Hopkins in the Baltimore, Maryland area. And so nothing unusual about that. But what they found, and it's not the first time that they've done this, they took the cells from a patient, a biopsy and send them to the lab. And they would do research on them without informed consent. And remember, that's the common theme that we've been talking about is informed consent. Well, most of the time when they would take these samples of cells and send them to the lab, they would die very quickly. But Mrs. Henrietta Lax's cells did not die very quickly. Not only that, something remarkable happened. The number of cells doubled in 24 hours. And they had never seen anything like this. And so they studied and researched Miss Henrietta Lax's cells. Well, this was in 1951, and this is 2024. Do you know that Mrs. Henrietta Lax's cells are still living and existing today? Her cells have been utilized for all kinds of research. Her cells have been utilized to help test vaccines. The COVID-19 vaccine was tested on Henrietta Lax's cells. They've been used to test the effects of radiations and poison, to study the human genome, to learn more about how viruses work. And they played a crucial role in the development of the polio vaccine also. So using these cells was a way to test different vaccines and medications and treatments without having to actually experiment on live humans. So they were using her cells. And they nicknamed these cells HeLa cells, HeLa, for Henrietta Lax. HeLa, He, the first two letters of Henrietta's first name, and La, the first two letters of Mrs. Lax's last name, HeLa cells. Now, what you should know is that this was common practice in 1951. We didn't really do informed consent back then. And she was not the only person to have their cells used in the lab to study. And this wasn't only done on Black people, okay? So let's just put that out there. But again, what was unique and remarkable about Henrietta Lax's cells is that they lived. Not only did they live, they doubled and grew and grew. So Johns Hopkins did not, or at least they say they did not benefit financially from the HeLa cells. Instead, they say that they never sold or profited from the discovery or distribution of HeLa cells, and Johns Hopkins does not own the rights to the HeLa cell. They easily shared these cells to researchers and research institutions all around because they could live and they were easily multiplied in a lab setting. So Johns Hopkins says that they offered HeLa cells freely and widely for scientific research. So this story, it's not a story, I mean, in terms of a fictional story. This is real life. It's nonfiction. But this story came to light because of the research of an author who decided to write this book on the immortal life of Henrietta Lax. Rebecca Skloot, Skloot. And because of her work, Johns Hopkins had to acknowledge what had been done. They did the right thing. They supported the research behind this book. They opened their archives and their files. They also allowed, when the movie was being produced, they allowed scenes to be shot on the campus of Johns Hopkins University. More importantly, Johns Hopkins did meet with the family of Mrs. Henrietta Lacks, and they are working to make amends with the family. So they are uh, trying to do the right thing. What have they done? They have done work to make sure that research is ethical and make sure that informed consent is something that has been established, because remember, at this time, there was no such thing as informed consent. Nowadays, if, let's say, some of your cells were going to be used for research, you would have to be given informed consent, meaning they have to tell you that they want to use your cells, what they would use them for, and give you all the details. And then they need your consent, meaning you have to give them permission. If you give them permission, you say yes, they can use it, but they still keep you informed on the research. If you say no, they don't use it. They only use people who give consent. So this is kind of, good and bad. I'm going to tell you what the bad of it. The bad of it is that, again, Mrs. Lax was not given the opportunity to give her consent. Neither was her family. And it went unknown for a long time. That's the bad. Silver lining. Because of this and other research studies like this, we do now have ethical standards as it relates to research, and they're very stringent. So that's a silver lining. The other silver lining is that because of Mrs. Henrietta Lax's contribution, there have been many medical breakthroughs. They've been able to do AIDS research, cancer research, develop vaccines, again, the polio and COVID-19 vaccines. They've been able to study research they've been able to conduct research on the effects of zero gravity in space, so they can see what the prolonged effects of zero gravity will do to the human cells, so that when astronauts go up. So now there are other cell lines that are used outside of Miss Henrietta Lax's, but HeLa cells have supported advances in most fields of medical research in the years since the HeLa cells were isolated and discovered. I wanted to talk about Henrietta Lacks because the book and the movie made this very popular, right? And it gave, hey, here's another reason why you don't trust the medical industrial complex. But again, this is an example of where a research institution acknowledged and tried to get it right. So they have used this as a case study amongst bioethicists worldwide. They have used it to set standards and guidelines for people who request research grant money from the National Institutes of Health. Also, Johns Hopkins has formed a board that oversees the use of these HeLa cells in research. And two of the board members who sit on that board have to be members of Mrs. Henrietta Lack's family. And they can decide or help decide what research her cells, these HeLa cells, are going to go to support. So I think that's a good thing. So let's talk about research and the timeline about how we used to conduct research and how it has evolved. So let's say informed consent, right? The practice of informed consent. In 1950s, there was no established practice for informing or obtaining consent from cell or tissue donors. Current practices, there are strict patient consent processes for those who donate tissue and cellular materials for research. That's present day. Collecting patient samples for research, 1950s. It was common that tissue samples were collected from cervical cancer patients, regardless of race or socioeconomic status. Today, any request for samples for research purposes would fall under regulatory and legal standards and the oversight, and we've said this term before, oversight of an institutional review board, or IRB. Remember, these are individuals who are separate from the research process, who know and understand what the rules and guidelines are, and are making sure that researchers are following those rules and guidelines. And if they're not, the study is stopped. Using patient cells for research. There were no local or national regulations in the 1950s and before. And now it is standard practice to have an IRB, Institutional Review Board, examine every research study involving human participants before it is approved. Before it is approved, which means before the research starts. They have to get the green light to proceed. Medical records privacy. 1950s and before, patients had no right to see or retain a copy of their medical records. No state or federal laws prohibited the sharing of medical record information in connection with research. Current day, present state, today patients have a right to see and have a copy of these medical records, and both state and federal laws regulate patient consent and the use and sharing of medical record information. We're talking about then versus now. Let's talk about race in research and segregation. Very few leading hospitals treated African American patients. The ones that were the exception who treated African American patients still segregated them. So black patients were treated in segregated wards at the time of Henrietta Lacks and for many years thereafter. Now, current state, present day, there are no segregated wards. Blacks and whites are treated on the same hospital wards. In 1973, all inpatient services were desegregated. So, why did you spend time going over this, Hernando? I'm glad you asked, because we have talked a lot about experimentation on African Americans without their consent, right? We've talked about the inhumane treatment of African Americans. We've talked about the withholding of life-saving and curative treatments African Americans for the purposes of research without informed consent. And that is enough to scare the bejesus out of you, right? But I wanted to round this off with the discussion of Mrs. Henrietta Lacks, because in this example, we see how medical research has evolved. And it's important for our community to understand how medical research has evolved. Why is that important, Hernando? I'm glad you asked, because today, individuals who participate in clinical trials and research studies actually receive a benefit. Today, if you have cancer, you want to be included in the cutting edge research trials, because quite often individuals with cancer who participate in the cutting edge clinical research trials, they get cutting edge treatment. They get above the standard treatment because it's a research study. And so you're going to be seen more often, so more appointments. You're going to be watched closer. You're going to have the benefit of very expensive drugs. Y'all know how it is when the new drugs, the new medicines come out, and the pharmaceutical companies get the patent on the medicine. They're very expensive, unaffordable. A lot of times insurance may not cover it. If it do, it's still a large out of pocket for you. Well, if you're participating in research studies today, all that is free. So you get monitored more closely. You get state-of-the-art care. You get the newest, latest, greatest of all the treatments. And what we see is that individuals who participate in research studies today, particularly for cancer, they have a better survival rate. So I don't want our community to be skittish when it comes to participating in research, because now that puts us at a disadvantage if we don't participate in research. Another thing, if the pharmaceutical companies and the researchers are developing a new medication, right? Let's say it's a blood pressure medicine, or let's say it's a new chemotherapy to treat cancer. But now we're doing immune therapy, which is different from chemotherapy. Chemotherapy uses toxins per se to kill cancerous cells, but then they also can kill some of your own healthy cells, which is where the side effects of chemotherapy come from. But now cancer treatment is starting to use immunotherapy, using your immune system to go and attack the cancer cells, the bad cells, and leave your healthy, good cells alone. Well, majority of the people who are participating in studies are middle-aged white men. So right now, the treatment regimens, the doses, and all that stuff that the standard treatments that they come with are based off of research that's done on white people. We need, in order for the research to be fair and balanced and equitable, we need a higher rate of participation of African Americans in clinical trials. And we all agree on this, whether white doctors or black doctors, white researchers or black researchers, our people are at a disadvantage because we don't trust the medical industrial complex. And so we don't participate in research trials enough. I want you to look up something for me. Look up precision medicine. Just Google precision medicine. Then Google the All of Us study. This is a study being sponsored by the NIH, National Institutes of Health, and is taking place all around the country. And it's looking at the human genome, it's looking at our genes. And what they're trying to do is be able to have a tailored approach to treating all kinds of things. Like a tailored suit. You can go buy a suit off the rack, right? From Belk or Jose Banks, wherever. Or you can have somebody come and put that tape on you and make a suit that's fit just for your body. I'm telling you, y'all, I'm speaking from experience. A tailor-made suit feels so much better than a rack-bought suit. Well, that's what they're trying to do with medicine. They want to be able to run labs on you, see what genes you have or genetic mutations you have, and they can look at that and tell this blood pressure medicine works better in you than this medicine, or this chemotherapy works better for you than this chemotherapy, or you have mutations in your genetic map for this. And so rather than starting to screen you for breast cancer at age 40, we need to start screening you at 30 or at 25. It's called precision medicine. That's where medicine is going, y'all. But again, we got to participate in this stuff so that we can benefit from it. So my purpose over these last several weeks have been to acknowledge what's happened to us in the past, to say that, yes, the mistrust is well-founded, but the connector is things have changed. The script has been flipped. And if Black people, we don't participate in research, we are going to continue to be at a medical disadvantage. And these healthcare disparities are going to continue to grow. You don't have to take my word for it. You can just Google NMA, the National Medical Association, which is an association of all of the Black doctors in our country, and see what their stance is on African Americans participating in research. They're going to say we need more African Americans participating in research. So this has been another episode of the Prescription for Better Living podcast. I've been your board certified internal medicine physician. Yes, your primary care extraordinaire, Dr. Hernando Carter, saying share the video, like the video, comment on the video, subscribe to the YouTube channel, scream from the mountaintops, hallelujah, Dr. Carter is here. Until next time, Dr. Carter out.